Welcome to Lesson 25, Immunity. In this lesson, we'll cover the structure and functions of the lymphatic system, types of immunity, common immune disorders, aging effects, vaccines, and QMA responsibilities. By the end of this lesson, you'll be able to identify components of the lymphatic system, explain how immunity works, understand vaccine use, and support immune health in residents. The lymphatic system is part of the immune system. It recycles fluids from body tissues into the blood and helps remove pathogens and dead cells. It also produces white blood cells that help fight infection. Lymphatic vessels maintain fluid balance. Nodes filter pathogens. The spleen stores immune cells and breaks down old blood cells. The thymus produces T cells, while tonsils and adenoids defend against airborne invaders. Immunity can be acquired naturally or artificially. Active immunity involves your body producing antibodies. Passive immunity comes from another source, such as maternal antibodies or antibodies injected for fast protection. So that would be like vaccines. When the immune system detects an antigen, white blood cells attack the invader. The body also creates antibodies which stay behind to recognize and respond more quickly if the same antigen returns. Immune disorders include autoimmune diseases where the body mistakenly attacks its own cells, and immunodeficiencies like HIV/AIDS, where the immune response is weak. Allergies are an exaggerated immune reaction to everyday substances. As people age, their immune system becomes slower to react. This makes older adults more vulnerable to infections, and they may not be able to respond as strongly to vaccines. Prevention and early detection are key. Vaccines are a safe way to develop immunity without getting sick. They help prevent the spread of diseases in communities. Older adults are especially encouraged to get vaccinated against flu, pneumonia, shingles, and COVID. QMAs are vital in preventing and identifying infections. Watch for symptoms like fever or redness. Promote hygiene and vaccine compliance. Administer medications and help maintain resident health through nutrition and hydration. Common immune-related medications include vaccines to prevent illnesses, immunosuppressants to manage autoimmune conditions, and antibiotics or antivirals to treat infections. Watch for side effects like fever, rash, or allergic reactions. Following infection control practices is critical. Wash hands, wear gloves, and clean surfaces. Dispose of contaminated items properly. Isolate residents in contagious illnesses to prevent spread. The immune system helps defend against illnesses and diseases. Aging, immune disorders, and infections require close monitoring. As a QMA, you will play an important role in supporting residents' immune health through prevention, observation, and care.